Good morning guys, welcome back to the Med Life. In this video we're going to talk about the lower limb. Basically the lower limb is your thigh, your hip, your knee, your legs and your foot. So your lower limb is basically built for support and propulsion. In other words, your lower limb is made to carry the weight of your body. So in this video, we'll talk about the bones of your lower limb. Let's start with the hip bone. Your hip bone, and which is also called the innominate bone, is made up of three other bones: the ilium, the ischium and the pubis. From there, when you come down, your thigh bone, which is called the femur, is the largest bone of your body, the femur. From there, you have your knee bone, which is called the patella. The patella is a very small and circular like bone which is located in your knee. Down there in your leg, you have two other bones, which are called tibia and fibula. Tibia and fibula. On your feet, you have 7 bones which are called the tarsal bones, 5 bones of metatarsal bones, and 14 little bones which are called the phalanges in your fingers. Let's start with your hip bone. Your hip bone is divided into ilium, ischium, and the pubis. As you can see, the superior part is the ilium. There are 2 inferior parts, are ischium and pubis. So in this picture, we have some of the bones labeled. What you are expected to know are some of the parts of these bones. As you can see, one of the very important things is called the iliac crest. Superior on the hip bone, on the ilium bone, you have the iliac crest. This is a place where so many muscles, tendons are attached. So you are basically required to know these information. Inferiorly, you can see the obturator foramen. A foramen basically is a hole, is where some things pass, like nerves, vessels, or some things pass from there. This is an obturator foramen. It's very important anatomically. There is some muscles that pass through this, some nerves, and some arteries also. So you are required to remember these ones as well. Between the right and the left pubic bones, you can see there is something that is joining them. That one is called pubic symphysis. This is also anatomically very important, especially in embryology. And when you're studying pelvis, this is important to know. To notice that pubic symphysis is located between the pubic bones. Posteriorly, we have the coccyx. This is very important when you study the pelvic, and especially in embryology, for when you want to take out the kid out of the mother's body. And from there, you can see the ischial spine that's posteriorly located, and this is when you study the pelvic, it's important. But also in the lower limb, ischial spine is important because so many muscles are attached to ischial spine, and you have to know their attachments. And majorly, most of the muscles are origined from the ischial spine, so you are supposed to know this as well. Just notice this when we study about the muscles. We'll tell you that some of the muscles are attached from this point. And then, now in this picture also you can see the hip joint. The hip joint is where your hip bone is connected to your femur, the bone of your thigh. The femur is connected to your hip bone. This is called the hip joint. This is a very important thing. You have to know its stability factors, the arteries that supply it, the tendons, the ligament, and the nerves that are located in this area. This is very important in anatomy, especially in the lower limb. As I mentioned before, your femur, which you can see in this picture in the red, is the bone of your thigh and the longest bone in your body. Proximally and superiorly from up, it's connected to the hip joint, and distally and inferiorly is connected to patella, tibia and fibula. This is the knee joint, your knee joint, and you can see patella in orange. This is the bone of your knee, patella. From there you have fibula in green and tibia in yellow. These bones are the bone of your leg. There are two bones basically there, and proximally from up superiorly they're attached to femur and your patella in the knee joint, and distally and inferiorly they're attached to your tarsal bones. You have 7 tarsal bones, which we'll go to them later on. You have 5 metatarsal bones and 14 phalanges. So this was an overview of the bones of the lower limb, and hope you guys enjoyed it. If you enjoyed, please like, share and subscribe to MedLife.